the improvement has to be positive for the patient. They need to define what the quality is, and for a long time providers have done that. Now the most important thing is to involve patients and for them to tell us what a good service looks like or what a positive patient experience looks like. And I think that really is the key to all this. It is about involving the patients.
Appreciated the training aspect of it. We have done lean in the past, and with the consultants, the John Black and Associates that we are working with now, it's a very structured process. And the piece that I really appreciate is that there is a critical mass of people that are starting to get trained, and so we're all learning this together, and we are all on the same journey together.
I think just the overall philosophy of lean in that you're always trying to eliminate waste. And so if we think of our customers being our patients, getting the nurses to the bedside, reducing what isn't value added to the patient. So there are a lot of things that we do, of course, that have to be done that may not be at the bedside, but can we reduce that to the very least amount of time so that they do have more time to spend with their patients?
So we refined our processes to actually look at that. And today, a client can walk into the office, be seen the same day. We'll get the file open, we'll screen them, we'll triage them into where they need to go. Is our service even the right service? Do they need detox? Do they need, perhaps it's inpatient treatment? So we'll sort all that through. If they want to book appointments, we'll book them appointments. If they would rather come in on an as-needed basis, we allow that to happen too. So it's really about meeting the needs of the client. What we found out was that when we did that, suddenly our staff had better control of their time. They felt more productive. Our no-show rate dropped to at the last tracking was around 25%. So all of the good things that we wanted to happen started to happen.
Well, it's organized, like in certain rooms in emergency, like the trauma B room. Everything is marked off. It's taped off on the floor, so a certain instrument belongs there, so that it's not as cluttered looking along their main table on the counter. Everything seems to be in a designated place now, so the room is more tidy looking, and it's more efficient for us when we come in to clean it as well. When we clean, then we're not guessing if we should be moving something. This is where it goes. You just move it, you wipe it, put it back. So it takes less time to do a person's job when it's all organized.
And here's my desk after. And here's my drawer after. And here's my new shoe rack. And so the benefits of this was that it made some room for me to sit at my desk in front of my computer and actually be able to write on a document in front of my screen. So we just did some shuffling. And I thought it was helpful because it was so neat and tidy. It just kind of felt better being in there.
So this graph just shows our pre-Kanban dollar amount at $831 for inventory, and post-Kanban $358 for a savings of $473. And the other side shows our number of products starting at 45 as our baseline pre-Kanban, and post-Kanban at 20 for a decrease of 25 products.
For card F, we had a 61% decrease in inventory, and 17% decrease in SKUs, and the cost savings was 79% reduction. Cart B, we actually had a 25% increase in inventory, although a 45% decrease in SKUs. So we removed items that we didn't need and had an appropriate amount of what we were actually using. And even with increasing the amount, we still had a 73% reduction in cost. So there's a 68% in cost.
It was a challenge to focus on one specific area, and at first you didn't realize how much things needed to be changed from looking at it, even though I was in the process, but looking at it piece by piece and realizing the work that needed to be done, I had no idea.
We accomplished a lot and we learned a lot through the process. We created an electronic referral process. We developed a process to schedule clients during intake. And what we learned is how important standard work is, and also how to deal with resistance to change. We've also found out that timing processes are much harder than they actually look. And the most important thing is that our clients now have quicker access to an appointment, and this is really important for client safety and client satisfaction.
In a week, I doubted that. I thought we'd get a lot of it done, but certainly not to the extent and the swiftness that we did. So again, I think that was a plus for the organization team to keep us on our toes, and the outcome from the results that we had, the comments back, and what we saw ourselves, I think should make us very happy. We accomplished a task that looked just unsurmountable at first.
Any approach that we can use to streamline, so we take that kind of organization or administrative piece out of the process, is so much more beneficial to our clients.
Well, over the next 12 months, we'll be doing somewhere close to 20 RPIWs, and so I'm really looking forward to what the outcomes of those RPIWs are and how that improves the system. And also being able to involve so many patients. It will be really interesting to hear more perspectives from the patient's point of view.
I'm excited to see what will come, because I've seen the floor change multiple times, from turnovers with staff to turnovers how we do things. So I think it'll be a positive thing.
And I really do want to thank everyone who came today. I think you have you've heard some of the messages that you and your colleagues will hear more of, and we will improve, and we will benefit the people we serve.